Welcome. I'm Sandro Galea. I serve as Dean of the WashU Bursky Public Health, and welcome to Public Health Ideas. These are conversations that aim to highlight work that advances the science of health. Today, I have the privilege of speaking with Professor Jacquelyn Benson. She's an Associate Professor of Medicine at WashU with a secondary faculty appointment in the Bursky School of Public Health. I am delighted to be joining her for a conversation about well-being of older adults and caregivers. Jackie, welcome.
Thank you, Dean Galea. It's my pleasure to get to be here.
Let's start with your background. Tell us, how did you come to be doing what you're doing?
Yeah, I appreciate this question because I do think that it's worth sharing a little bit about where I'm coming from, because it shapes how, of course, what we'll talk about today and these aging issues. So as you mentioned, I'm faculty at School of Medicine, and I had the secondary appointment in the School of Public Health. But I'm not a clinician, I'm not a physician. I'm trained as a research scientist, specifically in family gerontology. And what that means is my entry point into a discussion about aging and health is through families, how families transition, family relationships, of course, caregiving dynamics that arise as people grow older. And then in my work specifically, I study what happens to families when an older adult becomes seriously ill. So I think that framing is really worth explaining as we have this conversation, because it really shapes everything I think about as we talk about older adults and caregiving. And there's also a really important concept in life course theory. Have you heard of this theory? Yeah. So that framework underlies much of gerontology, and it certainly shapes how I think about the questions I'm asking in my research and the interventions we're designing. And the specific concept I want to bring up is the one of timing and events being on time and off time. And an off time event is exactly what you would expect. It's when something happens outside of what we socially expect for a given stage in our life. And with older adults, relating it to my work, when they become seriously ill, we actually often think of that as an on-time event. We don't think of it as particularly remarkable sometimes. It's because it's expected, and because we expect it, the problem with that is that we invest less in supporting than older adults and the people who care for them. So and when we think about that, we don't normally do that or have that sort of reaction when it's a younger person who becomes seriously ill. So it's that issue, that gap between older adults and the caregivers, what they actually need, and the services that we have available to them and what the systems provide. That's where I would say my work lives and really kind of motivates the research that I do.
So in the space where your work lives, I know it's hard to reduce things to a single thing, but what do you think is the single most pressing concern right now?
Single most pressing concern? Well, I don't want to dismiss that there are real disease burden is a real significant issue, but I would say it's probably related to my work. What keeps me up at night is the issue of social isolation and loneliness with older adults. And as you know, the U.S. Surgeon General has issued an advisory on this a couple of years ago. So that's great movement to see that loneliness has been framed as a public health epidemic, and particularly older adults, as he has pointed out, are disproportionately affected by this. So that to me is what motivates a lot of the work that I do.
So when you think about sort of older adults, people getting older, wanting to age well, and there are challenges to that, but what do you think are the foundational structural challenges we face in this country?
There are many, and they compound in each other. I'll try to talk about several quickly. So income, most older adults are on fixed incomes, and out-of-pocket costs are real for them. Geography is another structural barrier. With rural adults in particular, they face provider shortages and transportation barriers that people in urban spaces don't normally face. Ageism is another major concern that I have, that we just don't really give much attention to, at least as much as I think that we should. It's really baked into, ageism is baked into how we design systems and how we allocate resources, right? It's not just individual attitudes. So I would say that's important. I'll mention two more, like cumulative disadvantage. We talk about this a lot when we talk about life course, of course, and those inequities that specific groups of older adults face, they don't start at 65, right? They are accumulated across a lifetime. And then caregiving is the last I'll mention, of course, that infrastructure to support caregivers is inadequate right now. It's severely, it's unevenly distributed, and right now under significant pressure in terms of funding. So I think with caregiving in particular, though, what's important to recognize is that there has been real progress in recognizing caregiving as a public health issue, as I mentioned with the Surgeon General, naming caregiver isolation as a public health concern. I think that momentum is real and important to recognize, but so is the fiscal pressure that we are seeing, in particular with Medicaid funding, and that funding makes community-based care possible for older adults and for the people who are caring for them. So it's, of course, all these structural barriers, particularly nuanced, but I think arguably kind of a fragile situation we're in, particularly with Medicaid funding.
So you led into caregiving, which is where I was going to go. So what do you think are the most promising strategies to support caregiving, prevent burnout, and make sure that caregivers themselves remain healthy?
Yeah, I love this question because there are actual real solutions here that can help. But before I mention them, I definitely want to recognize the fact that with any of these solutions, they only work if caregivers can access them, right? So a caregiver who is working full-time, who has no respite, who has no financial cushion, doesn't have equal access to these supports. So I like to highlight ones that I think are a little bit more accessible, because there are a number. And the first I'll mention is peer support, which is really near and dear to me and something that I focus on specifically in my work. And I will say, particularly with online peer support or technologically mediated peer support, it can be through the telephone, it can be low tech, it doesn't have to be online. And allowing caregivers to connect with one another when they connect with someone who's been in a similar experience to them, it's uniquely powerful in a way that professional support just sometimes is not able to provide, or oftentimes. And it's just, there's something about being understood by someone who has lived it that reduces isolation. It helps build resilience and coping strategies in ways that we can actually measure. And our team is working on doing that, and that's really an exciting space to be in. And then doing so through online communities, whether it's in groups or one-on-one, it makes that connection available at 10 o'clock at night, when they're at their kitchen table, whenever it works best for them. And it doesn't require referral, it doesn't require a copay. So I think that's incredibly accessible support strategy they can pursue. A second is skills-based programs, and there are many of these evidence-based interventions that exist out there that teach caregivers problem-based problem-solving strategies, coping strategies, emotion regulation strategies, and that are specific to their situation as caregivers. So I'm not talking about just generic stress management programs, although those can be effective too, but these interventions I'm talking about are specific to caregiving. And historically, they were often more rigidly structured, maybe offered on a Wednesday night for 2 hours. You couldn't miss a session, or you wouldn't be able to continue attendance. That's really shifted, thankfully. We're responding to caregivers as we engage in more community-based research and amplifying their voices and learning from them to change interventions. And we're seeing that. So they're becoming increasingly more available in flexible formats, online, and on demand, so whatever works for them in terms of access. And I don't mention any specific ones because there are so many and they're always changing, but the last resource or strategy I want to offer and suggest that is really underutilized, and I think that is the social worker on a caregiver's family member's care team. Mm-hmm. So caregivers often don't realize this is a resource. The social workers are a resource for them as well. It's not just for the patient. We see this often, that they don't recognize that individual is there to support them. And those social workers, they know the community landscape, or a good social worker will know that they can connect caregivers to those peer support programs I just mentioned, to any of the more structured skills-based programs that really fit their specific situation. So that's accessible. That's something that I think is a deeply underutilized resource, but can really connect them to much broader resources specific to their own community. So start with caregivers would be my kind of final recap on that.
So you actually almost edged into my next question, which is about technology. Sometimes I worry that in the public conversation, we always keep holding technology almost the answer to everything, which of course it's not, but of course it is helpful, an answer to some things. So lead us through from your lens, you're an expert in this. Where do you see the most promising places where technology can actually help with this, help with making sure that we can age well and caregivers can support those who are aging who need support?
Yeah, so I mean, I already mentioned the mediums we can use to connect people to increase human connection. And technology is a fast changing landscape. It's certainly not my specific area of expertise, but I think I can speak to a couple things that we have seen really work to promote palliative care, which is the space that I live in here at WashU predominantly, and that's telehealth. And I'll add remote monitoring to that. So that expands access to care, particularly for older adults in rural or underserved areas. And then the next I'll mention is smart home technology. It's been around for a really long time, and it changes all the time, and generally for the better as technology tends to advance in that direction. But it's predominantly focused on the same things, and that's fall detection, that's medication management, that's voice-activated assistance. And that supports older adults in maintaining safety at home and remaining independent at home so that they're not having to make a transition to skilled care. They're not new, but exciting advances because they tend to continue to support older adults in that mission.
Let me ask now a really big question. Let's talk a little bit about healthcare system, insurance, and all that. And the administrative burden that's associated with healthcare delivery is well documented, and it's very clear that that is one of the perhaps hindrances to people to age with well-being and navigate the system as positively as possible. So what are your insights on this? How do we create systems that are better to support healthy aging?
I want to bring up something that I think is broken but fixable, and I don't want to dismiss the reality of patients who do not have a caregiver, because that is the case for some. But for most patients, they have a caregiver who is present at nearly every clinical encounter, especially in serious illness. So, as I mentioned earlier, the healthcare system is entirely dependent on caregivers, and with that, what I mean is we tend to put a lot of burden on caregivers to do a lot of the healthcare management for patients. And yet, in most clinical settings, we are not formally identifying or documenting who the caregiver is, and we're certainly not assessing them and documenting how they're doing. So that's a challenge, and what better looks like to me is that it's pretty straightforward, is that we actually start documenting caregivers. And we are starting to do that, but we need to do a better job of doing that systematically. And that doesn't just mean who is your emergency contact, which is often the question that asks. It's more specific to who is helping you, who is helping provide care to you at home, asking how they are doing if they're not present, and asking what they need. But if they are present, and as I mentioned, many of them are, there are valid tools for doing this that clinicians can use. They are simple 1, 2, 3 item measures that can quickly assess this. And so, as I mentioned, we have healthcare systems who are beginning to do this. Ours here at home, I'm working with a great team in psychological services at Siteman Cancer Center and radiation oncology, where we're trying to work into the clinical workflows a more systematic process for assessing patient distress. And we want to move that then to caregivers as well, assessing their distress regularly and making sure that that is reoccurring and documented into the medical record. So I bring that up, and why I think it's important to bring attention to it is that the change does not require any sort of legislation or new funding. It really just requires a shift maybe in thinking about how we define who the patient is, or at the very least kind of having a more conscious consideration for who else in the room with the patient really deserves our attention. So that to me is a very simple solution to fixing a problem that would have a cascading effect at helping patients and older adults, because caregivers are so central to their care.
I like you taking like one very specific solution, which actually could make a big difference.
Yeah.
Let me change tack for a second. And you hinted at some of this earlier, but lead us through intergenerational sort of support and for older adults, and what's the role of that and benefits of that, and how does one perhaps elevate it?
I like this topic because it comes back to what I brought up as one of the most pressing health concerns, which is social isolation. And with intergenerational relationships, we actually see that those relationships are really powerful antidote to social isolation for older adults. Research has been pretty clear, although it's stated, but it seems to still stand that meaningful contact between older adults and younger generations reduces isolation for older adults. It helps increase their sense of purpose. That's also true for the younger adult in that dyad. And it's associated with reduced depression. And as I said, it works both ways. And another interesting outcome for younger adults, when they have genuine relationships with older adults, it helps them to develop a more positive attitude toward aging. And I think that matters tremendously in a society like ours, where we tend to push older adults to the margin, and we still are, have of course issues with ageism, as I mentioned, informing kind of the resources that we offer. If we are shifting the mindset of younger adults, I think we'll see some of those problems begin to dissipate. And I want to say, in terms of these relationships, the key word here is meaningful. So it's not just about proximity. You can't put older adults near younger adults and expect magic to happen. There has to be genuine exchange. And there are some programs that exist that are built around exactly that insight. Have you heard of the shared site model? Have you heard of this concept?
Lead us through it.
Yeah, so the shared site model is where preschools are co-located with senior living communities, and the children in the preschool and the older adults are just able to then naturally and regularly have connection and interaction. These are new programs. I think the evidence it's early but quite promising, and I think it's a model that's worth watching and investing in. We've also seen, less in the US, we see more of these programs. They kind of get launched in Europe, and then we become interested in them. But another model that we are seeing is also with college students, or in the college setting, where we bring older adults into the space at universities, and they get to interact with those young adults and create meaningful connections, similar to what I shared with the preschools and with the older adults, where there's actual deliberate opportunity for them to interact in a meaningful way.
So let's move from relationships now to physical structures, because one of the challenges, of course, to aging, particularly to aging healthy in people's place, are the structure, the way our societies are built physically, the way homes are built, the way communities are built. From your lens, as somebody who studies this, what should be our leading priorities in terms of thinking about fixing that? What should we be building differently, both in homes and in communities, so that people can actually be mobile and as engaged for as long as possible?
Yeah, I think that the exciting solution to that, so you've probably heard of age-friendly communities and designing in that space, and maybe we shouldn't even use that language, because age-friendly communities are, to me, and many others will say this as well, it's universally designed communities. So if we are designing communities with older adults in mind, that tends to work better for everyone. So what I'm talking about here is walkable neighborhoods and sidewalks and bike paths, accessible public transit, having mixed-use design that puts social services and social opportunities within reach together in one space. So these are the conditions, I think, that make aging in place not just possible and meaningful, but also for anyone at any point in the life course, in the life stage.
So if you were to, have the magic wand question, think about one or two policy solutions that the country should be implementing today to make sure as many people as possible live long, healthy, engaged lives, what would those be?
I think a few, I'll try to pull threads together, because I think there's some that I haven't mentioned. So at the federal level, I think there is evidence around Medicaid funding, right? That's one that I mentioned, for home and community-based services. These are programs that allow older adults to remain in their homes and in their communities rather than moving into institutional care. And Medicaid has been the primary payer for long-term care in the United States, and its adequacy, we know, is a direct determinant of older adult health and caregiver burden. but recently the enacted federal budget reconciliation law, as we know, has identified reductions in Medicaid that will reduce spending by approximately, I think it's $900 billion across the next 10 years. And so going back to the home and community-based services that I mentioned, those are optional under federal law. So they're among one of the first things that, of course, states have to cut when federal funding shrinks. So, and this isn't a political statement, it's just a structural one, right? That where the projected consequences to older adults and the people caring for them are pretty significant. And so I think we have to figure out a way to address the gaps that are going to be made with those funding cuts. But I do think at the same time there are some genuine bright spots we've seen with policy. The Credit for Caring Act, that provides federal tax credits for working family caregivers, and that has bipartisan support in Congress. It's very exciting to see that. And we know that several states have already enacted those caregiver tax credits. The guide model, I can't recall if I've mentioned that, but the guide model was launched by Medicare, and I think it was 2024. So we've been rolling it out for the last couple of years, and that represents a really meaningful federal commitment to dementia caregiving families. We have organizations within our own community here that are delivering the navigation services that the guide model provides to caregiving families in dementia and Alzheimer's. And I think it's important just at the local level. I guess it's not a specific policy, but it's important, I think, at the local level when we are facing these federal funding shortages to remind ourselves about the agency that we have in creating change. And we don't sometimes recognize the control we have with moving the needle and designing for age-friendly communities, right? And investing in senior centers and in transportation. These caregiver navigation programs, while I just mentioned one that does or did have congressional support and funding behind it, some of these programs can be instituted with very little funding. They can be delivered by volunteers. And there are navigation programs in health systems that are sometimes delivered by patient navigators in a volunteer setting. So they do require, of course, at the local level, it requires local will and local investment. But I think, as I mentioned in this moment, when federal policy is really uncertain, that local agency that we have really matters quite a bit and more than ever, and something we can kind of fall back on in realizing that we have some control in how we can make our own communities better.
My last question, what gives you hope in the moment?
I have to remind myself of, right, we all have to remind ourselves of hope in these times. I think the thing that I always go back to is that what the science tells us, that what we know and what we actually do for older adults and caregivers is closable. That is a closable gap. We do have answers to a lot of solutions. It's just about working toward them, and people are working toward those solutions, closing that gap from multiple directions. So some exciting advancements in science in dementia, for example. We've crossed a threshold that we've never seen before in terms of medications that can slow the progression of Alzheimer's disease. We've seen very recently, like in the last several weeks, new news in terms of slowing the progression and even reversing the ALS as it progresses. And similarly, we've seen with pancreatic cancer some really exciting news coming there. So that gives me hope, and I think also that caregiving finally being recognized as a public health issue and not just a family matter is important and gives me hope. And the last thing I'll mention, and this is something I've seen in my own work and is simpler than the things that I've just detailed, and that's when I get to witness what happens when one caregiver reaches another, when they have that connection. I think that is a public health intervention that at its most fundamental level, it operates in terms of human connection. And that's something that is infinitely scalable and accessible, and we know can solve the solution, or can be the solution to the social isolation and loneliness. It's something that we can all capitalize on, right? So I'll end with that as my hope for the future.
plenty of reasons to give us hope.
Yeah.
Jackie, Professor Benson, thank you. Thank you
Thank
for the work
you.
you do, and thank you for talking with us, and thank you for joining this conversation.
Thank you for having me.